From simple X-ray photographs to computer images produced by magnetic resonance imaging, there are a whole range of different techniques available to doctors for looking inside our bodies. How do they decide which one is most appropriate for a particular patient with particular symptoms? Well, that's just one of the questions we'll be addressing here at the busy Princess Margaret Hospital in Swindon. Let's start by looking at the physical mechanisms involved. I'm joined by Alan Davis, who's Head of Medical Physics here at the Princess Margaret Hospital. Alan, would you like to just tell us something about the range of techniques you have available here in the hospital?
Well, the most common of all the medical imaging techniques is still the conventional X-ray. We have 9 main X-ray rooms in this hospital. Additionally, we have a number of ultrasound sets. We have a gamma camera for nuclear medicine imaging. We have a CT scanner, that's a computed tomography scanner, and an MRI unit, a magnetic resonance imager.
Great. Well, shall we go and have a look at some of the modern technology we've got here?
Let's go and have a look in the MR and CT unit.
Right. What's the purpose of this? Security barrier, is it?
Yes, on the other side of this barrier are both the CT and the MRI units, both of which have their attendant risks. The risks associated with CT can be well confined within the scanner room itself. On the other hand, the very strong magnetic field of the MRI scanner can potentially cause effects outside of the room. So this is the first level of access control to this unit. Anybody who goes beyond this barrier will be closely supervised and will be required to fill in a fairly detailed questionnaire to ensure that they won't be affected by the strong magnetic field. But as we've already been through that with you,
yes.
We'll go on.
Thank you. So this is where patients come for CT and MRI scans. Shall we start with CT? Would you like to explain to me how these images here are formed?
Okay, we've got 2 video displays here that we can see. One is a conventional closed-circuit television display, which just allows us to monitor the patient during the examination.
No patient there at the moment.
No, that's right. No, that's right. It's, the larger display has the cross-sectional image that the CT scanner produces. This is one overhead. The CT scanner uses an X-ray tube similar to those which are used in conventional X-ray sets, but this X-ray tube rotates around the patient, and detectors on the other side of the patient pick up that signal, and from the whole data that's acquired during a single rotation, a slice of the patient can be acquired and displayed on the screen.
So CT scans are using X-rays, ionising radiation.
That's right.
Now, gamma rays are also another form of ionising radiation. How do you use those to do medical imaging?
In nuclear medicine, we image the distribution of radionuclides within patients. The radionuclide will be injected generally into the patient, and depending on the compound to which it's attached, it will spread throughout one of the organ systems, or perhaps more than one organ system of the body, and the gamma camera is capable of imaging that distribution. The important thing one of the important differences to note between something like CT and nuclear medicine is in CT we're imaging anatomy. In nuclear medicine we're looking at the function of the organs rather than the anatomy.
Well, let's move on to techniques that rely on non-ionising radiation. Now, this is the MRI machine.
That's
now,
right.
These images look very similar to the CT images we saw earlier on.
Yes, both CT and MR produce very high quality cross-sectional images through the body, but that's really where the similarity between the 2 techniques ends.
So how are these images produced?
Well, the patient here is placed inside a very large static magnetic field, and as they're placed in that field, the protons which make up the nuclei of the hydrogen atoms will align along the magnetic field. As they align, they will also precess around their own axis. The frequency of that precession is going to be determined by the magnitude of the static magnetic field. If we were to now switch on a radio frequency source tuned in precisely to the rate of that precession, then a resonance effect will take place and the protons will absorb the radio frequency energy. Switching off the source of the radio frequency energy will then allow the protons to give up their energy, again as a radio frequency signal, and that can be detected by a sensitive coil or aerial, and that signal gives us a measure of the proton density and information about the local chemical environment of the protons.
So the signal you get back depends on the environment of the hydrogen atoms, is that right?
That's right. As well as the density of the hydrogen atoms, the local chemical environment which they find themselves in will also affect the size of the signal we get from the system.
So you get a different signal depending on whether it's in fat or water or,
That's exactly
or
right.
whatever. Right. And it certainly gives you some wonderful images, doesn't it?
They really are very nice, yes.
So we've looked at CT and we've talked about gamma cameras and MRI, and all of those involve electromagnetic radiation. Are there any other kind of waves that we can use to get images of the
Well,
human
ultrasound,
body?
of course, is used
Of
for
course.
imaging.
Right, should we go and have a look at that?
Yes, indeed.
So this is your ultrasound machine, is it?
This is one of the Doppler ultrasound machines that we have in the hospital. Now, unlike the other techniques we've looked at, ultrasound, of course, employs no ionising radiation and has a wide range of applications within medicine. The one that most people will be familiar with, of course, is antenatal screening for pregnant mothers, and used for sizing the fetus and monitoring the progression of the fetus. But it has a wide range of applications beyond that in the cardiac area, for looking at livers, and in this case here we have a Doppler ultrasound scan of a carotid artery. I could demonstrate how we do that using the transducers we've got here, which acts both as a transmitter and a receiver of ultrasound energy. It would be simply a question of placing the transducer on your neck with a suitable coupling gel to ensure that we don't lose any of the high frequency ultrasound energy, and with a bit of careful positioning we could get an image similar to the one we've got on the screen.
So what's happening there? The ultrasound is going into my neck and being reflected back out again, is that right?
That's right. The ultrasound is reflected from any boundary within the body, and the time it takes for the reflected ultrasound energy to get back to the transducer is used to calculate the depth of that boundary within the patient, and therefore using a large number of transducers which make up the array, an image of the structure can be formed.
What about using the Doppler effect in ultrasound? I believe that's possible.
That's right, yes. On the display here we have a demonstration of that. The colours represent the flow of the blood. If I start the tape going, then we can see that the blue colour is showing blood flowing towards the transducer, and the orange flowing away from the transducer. So we can see that the transducer is just fixed in the centre here, and we're getting no Doppler signal directly underneath it.